Hello everyone, myself Dr. Sanjay Kumar Soni. In this video, I am going to discuss with you about the detailed anatomy of the neck. What is neck? It is the that part of person or animal body that connects the head to the rest of the body. Now, coming on to the anatomy of the neck. The side of the neck present somewhat a quadrilateral outline, limited above by the lower border of the body of the mandible and an imaginary line extending from the angle of the mandible to the mastoid process, below by the upper border of the clavicle, in front by the midline of the neck, behind by the margin of the trapezius muscle. And now coming on to the what are the various structures present in the neck. The various structures that are present in the neck are voice box or larynx, thyroid gland and parathyroid glands, submandibular salivary glands, tail of the parotid salivary glands, sternocleidomastoid muscle, strap muscle, platysma muscle, carotid sheath and major arteries and nerves. This include carotid artery, internal jugular vein, hypoglossal nerve, spinal accessory nerve, trachea and esophagus, and lymph nodes are present in the neck. As I have already told, neck is quadrilateral in outline, and this space is subdivided into two large triangles by the sternocleidomastoid muscle. Two large triangles are anterior triangle and posterior triangle. Anterior triangle is reverse cone shape with the base lying towards the lower border of the mandible and apex at the clavicle. Posterior triangle base towards the clavicle and apex towards the mastoid process. Boundary of the anterior triangle on above side by the lower border of mandible and an imaginary line from the lower border of mandible to the mastoid process. In front by the midline of the neck and behind by the sternocleidomastoid muscle. Anterior triangle. Midline of the neck, behind by the sternocleidomastoid muscle, base toward the lower border of mandible and a line from the angle of the mandible to the mastoid process. Anterior triangle. Anterior triangle is further divided into four smaller triangles by digastric muscle and the superior belly of the omohyoid. Digastric muscle and superior omohyoid divides the anterior triangle into four smaller triangles. Number one, inferior carotid or muscular triangle. Second, carotid triangle. Third is submandibular or digastric triangle. Fourth is submental or suprahyoid triangle. Now coming on to the inferior carotid or muscular triangle. The boundary of muscular triangles are front by midline of the neck from the hyoid bone to the sternum, behind by the anterior margin of the sternocleidomastoid muscle, above by the superior belly of the omohyoid. This triangle is covered by superficial fascia, platysma muscle and deep cervical fascia. Important structures lying in this space are carotid triangle. In carotid triangle are carotid sheath that have common carotid artery, internal jugular vein, vagus nerve. One important thing that I want to tell here, on right side of the neck, internal jugular vein lies lateral to the carotid artery. On left side, vagus nerve lies between the common carotid artery and the internal jugular vein. Behind the carotid sheath are the thyroid artery and recurrent laryngeal nerve. On its medial side lies esophagus and trachea, thyroid gland and the lower part of the larynx. Now coming on to the carotid triangle. Boundary of the carotid triangle: behind by the sternocleidomastoid muscle, below by the superior belly of the omohyoid muscle, above by the stylohyoid muscle and the posterior belly of the digastric. Now coming on to the content of the carotid triangle. Content of the carotid triangle. It is covered by the superficial fascia, platysma and deep cervical fascia, ramifying in which are branches of the facial and cutaneous cervical nerve. This space contains upper part of the common carotid artery which bifurcate into internal carotid artery and external carotid artery opposite to the upper border of the thyroid cartilage. Branches of the external carotid artery in this space are superior thyroid artery running forward and downward, lingual artery running forward, occipital artery, ascending pharyngeal artery, directly upward on internal carotid artery, and facial artery. Veins lying in this space are internal jugular vein, which lies lateral to the common carotid artery and internal carotid artery. Nerves in this space are hypoglossal nerve that crosses both internal carotid artery and external carotid artery. Above, on lateral side of the vessels lies accessory cranial nerve that runs for a short distance before it pierces sternocleidomastoid muscle, upper part and of the larynx and lower part of the pharynx are also found in this space. Upper part of the larynx and lower part of the pharynx are also found in this space. Now coming on to the submandibular or digastric triangle. Boundary of the submandibular triangle are above by the lower border of the body of the mandible line drawn from its angle to the mastoid process. Below by the posterior belly of digastric and the stylohyoid muscle. Front by the anterior belly of the digastric muscle. Now coming on to the content of the submandibular triangle. This triangle is covered by superficial fascia, platysma and deep cervical fascia, ramifying in which are the branches of the facial nerve and ascending filaments of the cutaneous cervical nerve. This triangle is divided into an anterior and posterior part by the stylomandibular ligament. The content of anterior part are submandibular gland, the anterior facial vein, facial artery and its glandular branch, the submental artery and the mylohyoid artery and nerve. The posterior part of this triangle contains the external carotid artery and deep part of parotid gland. Now coming on to the submental or suprahyoid triangle. Boundary of this triangle: behind by the anterior belly of the digastric muscle, front by the midline of the neck between the mandible and the hyoid bone, below by the body of the hyoid bone. Now coming on to the content of this triangle. Its floor is formed by the mylohyoid muscle and it contains one or two lymph nodes and small veins that unite to form the anterior jugular vein. Now coming on to the posterior triangle of the neck. Boundary of the posterior triangle: on front side by the sternocleidomastoid muscle, and to be more precise, the posterior surface of the sternocleidomastoid muscle. Behind by the anterior margin of the trapezius muscle, base by the middle third of the clavicle, apex lying upward towards the occipital bone or towards the mastoid process of occipital bone. This space is crossed by the inferior belly of digastric muscle at about 2.5 cm above the clavicle and divide into two triangles. Number one is Occipital Triangle and Subclavian Triangle. Now coming on to the Occipital Triangle. Boundary of Occipital Triangle: front by the sternocleidomastoid muscle, behind by the trapezius muscle, below by the omohyoid muscle. Content of Occipital Triangle: it is covered by the skin, superficial and fascia, and by the platysma muscle below. Content: this space contains accessory cranial nerves and a chain of lymph node along the posterior border of the sternocleidomastoid muscle, supraclavicular nerve and transverse cervical vessels. Now coming on to the subclavian triangle. Boundary of subclavian triangle: above by the inferior belly of omohyoid muscle, below by the clavicle, base Base is found by the posterior border of the sternocleidomastoid muscle. The size of the subclavian triangle varies. It depends on height at which omohyoid muscle crosses the neck. Second, this space is being diminished by raising the arm on account of movement of the clavicle. This space contains supraclavicular nerve and subclavian artery. External jugular veins lies behind the posterior border of the sternocleidomastoid muscles. Some lymph nodes are also found in this space. Thank you.